St. Elizabeth's Catholic General Hospital, Shisong, was started on the 15th of November 1935 as a small dispensary and maternity by 5 tertiary sisters of St. Francis from Brixen, South Tyrol, Italy. It was officially recognized by the government of Cameroon in 1952. Expatriate doctors volunteered to work in Shisong until 1972, when the first Cameroonian doctor was employed. Over the years, Shisong Hospital has progressively grown structurally and professionally. Some specialized departments like cardiology, obstetrics and gynecology, pediatrics, urology, general medicine, and the treatment centers for diseases like HIV/AIDS and tuberculosis render this health facility a great resource to Cameroonians and neighboring countries. The Cardiac Center of Shisong Hospital is the lone cardiosurgical hospital within the Central African sub-region with an estimated population of 40 million inhabitants. Follow-up of cardiac patients in different locations in Cameroon is a priority, as the Cardiac Center has organized the mobile clinics to minimize defaulters of treatment. The General Manager of the Cardiac Center, Sister Jetro Kenglefak, reviews the center's activities 5 years after takeoff.
I can say 5 years summarily has been sweet and has been sad. Sweet in the sense that we have dived into an experience which has opened us up to a lot of many more experiences. 5 years before, I had no clue about cardiac center management, cardiac pathologies, cardiac disease, sensitization, screening methods. But today, it's a whole different story. That's the sweet part of it, because of the knowledge you learn. You get to learn when you're being challenged. Sweet also in terms of the impact we have been able to create around. If you look around here, the hospital is full capacity, and that has been my dream since 1 year ago, where we have all the sections functioning in the right way, and that a situation where whenever somebody hears of cardiac center, a lot of people in Cameroon should say, I know it, I know where it's located. The impact we have created is really getting deep rooted, and we really hope to do much more. It's also been very sweet in terms of the challenges that we have faced all of this while, and more the way we have slowly, steadily, but gradually overcome some of those challenges. I'll talk the problem of the road, which was there in 2009, and today the road is tarred, almost completed. I'll talk the problem of electricity. It's not yet the best, but so far we got a big visit of the new GM to cardiac center, and things are ameliorating. I'll talk collaboration at the level of our ministry. It started very timidly. Today it is really becoming very serious. I'll talk the manpower that we have at the center. We started, I think we were just 50 at the beginning. Today we are 90. I'll talk the specializations that we have here. We started with 2 cardiologists slowly. Today we have 2 cardiologists specialized in interventional cardiology and pacemaker implantations, and even implantations of the defibrillator. This is new. And then we have a permanent cardiac surgeon. I talk about this training of staff, where we have 2 cardiologists now studying in Yaoundé to come back to work here. I mean, there is a lot we can narrate, but we feel great gratitude to God Almighty, who is giving us the wisdom that we need to do this job.
The clinical director of the center, Dr. Jean-Claude Ambassa, throws more light on the different cardiac procedures that are performed in Shisong.
So it is a pleasure for me to give you the difference between what we are doing in the cath lab, the laboratory catheterization, and then the cardiac surgery department. So first of all, when we call about invasive procedure means that you are using a vein or an artery to reach the heart and to have the complete information that the transthoracic echography cannot give you. In the other hand, you, alongside with the catheter, you can treat, meaning that you can open a vessel that is completely closed, or you can close a hole that is open inside the heart. This is what we call interventional cardiac catheterization. The first one was the diagnostic cardiac catheterization. Now, compared to the open heart surgery, the open heart surgery, by his expression, means that before you reach the heart, you have to open, to give an incision, and then you reach the heart to solve so many problems that can be the replacement of the valve, a closure of a defect, a hole inside the heart, opening of some vessels that are closed too. So this particularity is that they don't use a vessel to treat, but they use a surgical act that is open.
We had this morning an 11-year-old boy with triple valve disease. The etiology of the disease of the valve dysfunction was rheumatic, which is the most common etiology in our region. And the child unfortunately had an advanced stage also of heart failure. So the contractility, what we mean by the power of the heart to beat or to eject blood from the cavity, was reduced. So the procedure was a double mechanical valve replacement on the aortic and the mitral valve, and a third procedure was a tricuspid valve repair. Now the patient is stable. We think everything went well. The general conditions, as you can see on the monitor screen, are good. In the next hours, we will keep the patient in the intensive care unit for some observation.
Most cardiac patients are underprivileged, and some can barely pay for their diagnosis. This inability of patients to pay for their treatment has prompted the creation of the Social Case Management Office in the Cardiac Center. This office has enabled underprivileged patients to be treated with support from sponsors.
The social case is the office that can take care of the underprivileged patient who normally come to us for treatment, surgery, pacemaker, or cath lab. As you know, the cost of the surgery is very high for our population. Sometimes the cost can reach 3,800,000. So it's not everybody who can afford of this amount. The work of the social case is to find sponsors, to find donors, to help those who cannot afford of the cost of the intervention.
And since they operated the child is well, fine.
Given the sophisticated nature of equipment and the diversity in technical activity, the center has a technical department that is charged with the management and maintenance of all equipment. In spite of the challenges encountered so far, the general manager of the center really dreams big. Her vision for the cardiac center indicates that she is a daring woman and will not stop until her objectives are attained.
I want a standardized center, ISO 9001 registered certified structure. And what does that mean? It has to do with things like even level of taking care of the patient, the care that is given to the patients, feeding the patients, making sure they have all they need, the dressing of the patients, the quality of activities, the registration of all medical data so that the patient can get his information on the flash and be able to refer to next time, networking in the highest of possible standard, a full team, anesthesiologists, cardiac surgeons, ICU nurses, all the qualified staff at various levels in good number as backups, with backups, a full technical department for sustainability of the equipment and activities. I also dream, which is even now very, very strong in my heart, a city scan radiography unit. There should not be any referrals out.